Welcome to our guide on memory loss, exploring its causes, symptoms, diagnosis, and treatment. First, let's discuss dementia. Causes include Alzheimer's disease, which is the most common, stroke or vascular damage, Lewy body deposits in the brain, frontotemporal degeneration, head injuries, infections like HIV, syphilis, or meningitis, alcohol abuse, or poor nutrition. Symptoms often involve short-term memory loss, confusion about time and place, difficulty with language and problem-solving, poor judgment and decision-making, personality and behavior changes, and struggles with daily tasks. Diagnosis uses medical and family history, cognitive tests such as MMSE or MoCA, blood tests to rule out vitamin deficiencies or thyroid problems, and brain scans including CT, MRI, and PET. No cure exists, but management includes medications like donepezil, rivastigmine, and memantine. Lifestyle changes such as exercise, a healthy diet, and cognitive training are beneficial, alongside supportive care like family education and occupational therapy. Next, we focus on Alzheimer's disease, the most common form of dementia. It's caused by the buildup of amyloid plaques and tau tangles in the brain, leading to nerve cell death. Genetic risk, particularly related to the ApoE gene, plays a role, but age is the biggest risk factor, along with family history. Symptoms progress in stages. Early signs include forgetting names, recent conversations, or misplacing items. The middle stage brings increased confusion, difficulty planning, language problems, and noticeable personality changes. The late stage involves an inability to recognize loved ones, total dependency, and loss of mobility. Diagnosis involves a thorough clinical history, cognitive assessment, and brain imaging using MRI, CT, and PET scans. It's crucial to rule out other potential causes of memory loss. Treatment includes medications like cholinesterase inhibitors such as donepezil, rivastigmine, and galantamine, with memantine prescribed for moderate to severe cases. Non-drug strategies like brain exercises, maintaining a routine, and safety planning are vital, along with comprehensive family and caregiver support. Our third focus is Korsakoff Syndrome. This syndrome is primarily caused by severe vitamin bone, or thiamine, deficiency, most often due to long-term alcohol misuse. It can also result from malnutrition, eating disorders, or other chronic illnesses. Key symptoms include profound short-term memory loss, difficulty learning new things, and confabulation, filling memory gaps with made-up stories. Patients may also show apathy and a lack of insight. It sometimes follows Wernicke's encephalopathy, presenting with confusion, an unsteady gait, and eye movement problems. Diagnosis involves a detailed clinical history focusing on alcohol use and nutritional status, cognitive testing, and blood tests for thiamine levels and liver function. Brain scans may show atrophy in memory-related regions. Treatment requires immediate high-dose thiamine therapy, complete alcohol abstinence, good nutrition, and hydration. Supportive care and rehabilitation are also important. If treated early, some recovery of memory is possible, but if treatment is delayed, memory loss often becomes permanent. Finally, let's consider other, often reversible, causes of memory loss. These include depression, sometimes referred to as pseudo-dementia, brain injuries, or trauma, and side effects from certain medications like sedatives, antihistamines, or opioids. Thyroid disorders, vitamin B12 deficiency, and various infections can also impair memory. Symptoms like forgetfulness, poor focus, and general confusion may significantly improve if the underlying condition is properly treated. Diagnosis involves a comprehensive medical and psychiatric evaluation, lab tests for thyroid issues, vitamin deficiencies, and infections, and brain imaging if deemed necessary. Treatment focuses on correcting the underlying cause, which could involve antidepressants for depression, thyroid hormone for thyroid disorders, vitamin 12 supplements for deficiency, or stopping harmful medications. Counseling or therapy is also recommended if the cause is psychological.